started using the Z-flo, as most of you know. It's a fluidized positioner. It has whipped mineral oil in it. And we started using it, we did a trial, and the reason for the trial was because we had an uptick in the number of half-eyes we were having. An increase, I guess, was there more of an increase recently? So we trialed a couple different things. This is the one that seems to be working. And the Z-flo, what it does is it positions the weight better for long procedures. So typically we're using those for people who are having either deep flaps, spine, or neuro. And Dr. Chen is the exception to that. He doesn't like it, but maybe that will change. I heard he had some skin tears today. So cases over 3 hours for sure, those 3 procedures. Use your judgment though, there are other times that we might want to use them. Low BMI is a big one. Spinal injuries, incontinence, blood loss, poor nutrition. Those are some of the big ones. And these are how you put them on the Jackson prone table. There's a couple different ways. I'll talk about the other way in a minute, but this picture shows each of the posts, the ischial spine post and the thigh post. You take a piece of Velcro and you kind of go over and around, and it'll meet on the next one. The back will look like that. And then you use the positioner, the medium-sized positioner, and it will cover 2 posts. So you only need 2. So just put them in the pillowcases, and then they sit on the Velcro. Make sure, and you can see it here in this picture. You can see in this picture how it overhangs from the black post by a couple centimeters. That's for when the patient is positioned, it will slide down, so you give it a little extra space there. This white pillowcase that comes with this size will stick to this, but it's almost to hold it there while you flip. But the circulator should really be looking and making sure that once you flip, this has not slid down. It's pretty easy. It doesn't slide that much as long as you give it a little attention. Okay, go ahead. This is for the chest. So we're going to use you can use this, or if you're going to use the trunk table ones, it has a different chest plate, and I'll talk about the trunk one in a minute. So you have to cut it. Make sure you cut it along the short edge. If you cut it along the long edge, it will come out.
So when you cut on the short edge, you have to turn it inside out.
Yes, I'm sorry. So this is inside out, this one. Turn it inside out, cut it along the short edge, pull out the stuffing, and then you can slide the new one in. And then turn it back the proper way and put it on the chest part. And this is what it looks like when it's done. This should be, the one for the knees, it's a large one. So these 3 are the same size, they're mediums. This is the large one. Make sure you put this in a pillowcase. It doesn't come with its own pillowcase. There's no pillowcase on here, just so you guys can see what it looks like. The other way to do it is these 4 posts. They're small ones too. They seem to run out faster. The good thing with those is that you can then separate the posts if you need to, which spine doesn't seem to care about that. They don't do it a lot. That was one thing that Dr. Chen had a problem with, is being able to separate them. So if you use the smaller ones, it's going to be 4 instead of 2, 1 per post, and you can actually use the trump covers instead of doing the Velcro method. Now the covers that go with this, that usually go on the spine, the 4 blue ones, they're not tight enough. They won't hold these in. So you kind of have 2 options. It's 4 small ones with trump covers, or 2 medium-sized ones with Velcro. If you're gonna use 4 small ones with the trunk covers, go ahead and use the trunk chests, so you're not opening up 2 separate packs. And so that's it for the spine. So for DIEP flaps, we're doing it the bigger ones, the larger ones on the same one used for the knees on the spine. You're gonna use it on the feet and the head. So on the feet, make sure that you don't just lay the feet on them. The feet shouldn't be touching the gel or the positioner. You know, put it on the leg here lower, and it really molds. On this one, I even built a little like lip here, and then you can even carve out like little spots for the feet. And it worked really well. We used it for like 8 hours, and they don't move at all. That's the nice thing about these positioners. They hold their position for long periods of time. Same with the head. Make sure you don't just lay the head on it. You need to form it to the head a little bit. It's hard to see here, but the ears shouldn't be touching it either. You can carve out a little spot for the ears, push it around the back of the neck, so it's supporting the neck on that one. With the Velcro, it's important, I already told you about this part, to get that overhang there. The other thing is, the patient, if they're a larger patient like this one is, her abdomen, pannus here could rub against the Velcro. So stick a piece of egg crate in there, you know, check it like you would any other positioning device, make sure that, you know, nothing's going to cause any breakdown. It's single use only, 1 per patient. Make sure you label the Z-flo. It needs to have the patient's first, last name, and then write the words "do not throw away" on it, because although some of the floors, some of the nurses are familiar with it, I don't think that everyone is yet. So make sure you write that on all of them. All the ones you use, they go with the patient to the floor, and then they can take them home also. That's the last one. Documentation. So when you document, make sure you put it under the comment sections like you would. I put my Methylex under the comment sections. So same thing, put it under there, say where you used it on the ischial spines, upper thighs, the chest, the knees, the head, wherever you use it, make sure it's in there. And that's it.
So the big thing is